Mr. Shooty.
Hi.
I'm Jackie. I'll be your nurse today.
Okay.
So, I see that you were diagnosed with heart failure. It's really crummy. I'm sorry about that, but don't worry. There are things we can do to make your life a little better.
Okay.
So, let's talk about that.
Okay.
Things that will be important for you to pay attention to now are going to be if you have any difficulty breathing, if you have any weight gain of 3 pounds or more in a day, if you notice if you're having increased anxiety or restlessness, make sure to take your medications, follow the instructions that are on your pill bottles. Depending on what your doctor decides to put you on, there may be side effects that you need to monitor for. I see that digoxin is one of them that your doctor put you on, so what you need to pay attention to is report manifestations of toxicity, because increased levels of digoxin in your blood can eventually cause very serious complications. Things that you would need to call 911 for would be if you have swelling of the face, lips, eyes, or if you have itching or breathing problems, you need to go to the emergency room or call 911, especially if you're having breathing problems. If you have a heightened or sudden change in anxiety, you absolutely need to go to the emergency room for that, or a feeling of impending doom. If you have difficulty breathing and you start like coughing and have pink frothy sputum, definitely need to get seen for that. And then if you're experiencing a lot of tiredness, muscle weakness, definitely go to the emergency room for that. So, do you have any questions?
Not right now.
Okay. So these are on your no list. So no packaged foods, because packaged foods generally tend to be very salty, and you need to monitor how much salt you take in a day. Fried foods, kind of the same thing. Cheese, same thing. No sex until you can walk 2 blocks or go up a flight of stairs without having any breathing problems. If one of your calves was to be red and painful to walk on, then you should not massage that calf, especially if it's warm in the area where it is swollen. Go to the emergency room. More than likely, it's a blood clot, and you'll need to be medicated for that.
Okay.
Other things, so no low sodium or no sodium diet. Low fat, no fat yogurt is fine. Make sure you read food labels before purchasing foods. If you have any issues with that, we have a dietitian who can help you. Make sure you monitor your blood pressure and your pulse rate before taking any medications that are beta blockers, which always have an LOL at the end, because those can drop your blood pressure and they can drop your heart rate. So if your heart rate's under 60, you need to just hold that medication. Okay. Make slow position changes, because your blood pressure can change quickly whenever you're going from sitting to standing or laying to sitting. Sorry. Already said that. Allow for a longer warm-up time and cool-down time when you're exercising. It takes a little extra time for your body to kind of kick in. Good fats that you can have back to the diet would be olive oil or avocado. You can have eggs sparingly, and fresh fish, always a good choice.
Okay.
So make sure you avoid salt substitutes. They can increase your potassium level. So we don't want to solve one problem and cause another. Continue taking meds. Make sure that you're compliant with your treatment program.
Sure.
You will have far more success with your care in general if you are compliant with your treatment program. When your doctor says do something, do it. Make sure that family and caregivers know how to take your blood pressure, when to take your blood pressure, signs and symptoms of a stroke, which would be basically have them ask you if you smell burnt popcorn, or have them ask you to stick out your tongue, and if your tongue is going to one side and you can't make it go to the other side at all, probably a problem. Facial droop.
Okay.
And that's all. Do you have any questions?
I think so. I'm good.
Okay.
Great.
Thank you.
Thank you.
Have a great one.
You too.